Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and today we are going to look at peripheral arterial disease, or PAD as it is commonly known. You might have seen television ads for peripheral arterial disease and for some medications or for stent procedures. And I have been a cardiologist at the medical center for more than 30 plus years. I have dealt with thousands of patients with peripheral arterial disease who had all kinds of treatments and complications. So this will shed some light on your understanding of peripheral arterial disease and the gravity of situation as to how aggressively you need to be concerned about peripheral arterial disease. Today we're going to look at what is peripheral arterial disease, what causes peripheral arterial disease, how do patients present with symptoms, those who have peripheral arterial disease, how do we diagnose peripheral arterial disease, and how to manage peripheral arterial disease, and most importantly, what you need to do as a patient to prevent from getting any complications related to peripheral arterial disease. So let's start with the peripheral arterial disease. Peripheral arterial disease simply means there is blockage involving the arteries in the body, and most commonly it refers to the blockage that we see in the lower extremities. Here is a diagram showing normal blood supply through an arterial segment, and here is an arterial segment which is depicted here with buildup of yellow streaky fatty tissue, which is known as an atherosclerotic plaque, which gradually encroaches onto the lumen and decreases the blood supply. When the blood supply to a segment is reduced by more than 75%, then it manifests with symptoms. Peripheral arterial disease can also be seen in renal arteries or sometimes even in the arteries supplying the upper extremities. We have already talked about arterial disease involving the carotid arteries in a separate video, and please visit carotid artery disease video on our channel and review that. What causes peripheral arterial disease, or PAD? The most common causes for peripheral arterial disease are smoking, diabetes, hypertension, and high cholesterol. And the good thing about these risk factors is that majority of them can be controlled so that we can decrease the rate of progression of peripheral arterial disease. Peripheral arterial disease is a very nasty progressive disease, especially if we don't control the risk factors, and we're going to talk about that later on towards the end of the presentation. When a circulation to a limb is reduced by more than 75%, you may start off with muscle cramps, which is commonly known as intermittent claudication. As you walk a certain distance, you get cramps in your calf muscles, and it feels like a Charlie horse. But when the arterial segment blockage becomes critical, like 90% or 95%, you begin to see changes in the skin coloration and also ulceration. That is a case of a far advanced peripheral arterial disease. In worst cases, when the circulation is significantly compromised, it can lead to discoloration of the skin like we see here, which is dark, which may be a sign of gangrene. And if this gangrene is not promptly managed, it can lead to amputation or severe blood infection with bacteria. So it is exceedingly important to diagnose peripheral arterial disease at its earliest stages and manage it at the same time, modify the risk factors so you don't end up with these more advanced complications related to peripheral arterial disease. How do we diagnose peripheral arterial disease? Some of the common tests that can be done in a doctor's office include the blood pressure measurement in the arm and in the ankle and comparing the difference. If the blood pressure in the leg is considerably different from the blood pressure in the arm, that's an indication that there is poor circulation in the legs. This is sort of a very preliminary test, but it doesn't tell you where the blockage is and how significant the blockage. The next logical step would be to do a duplex scan or an ultrasound duplex scan of both leg arterial system, and there we can see if there is any evidence of physical blockage and the effect of blockage on the blood flow, on the velocity. Here you see an arterial segment. Here you see an arterial segment, and this is the blood flow. As you can see, there is significant plaque buildup with critical stenosis in this region, and that causes turbulence, which is reflected in the duplex scan as increased velocity. The normal velocity should be like 150 centimeters per second. Here it's like 300, which is double, and this is an indication of a critical stenosis in this arterial segment. And once we have established this, we need to do more definitive studies to establish the location and the degree of arterial stenosis, and that is accomplished by doing 3 different tests which give 3 different points of view, and it enables us to take a plan of action. An angiogram involves putting a catheter in the artery and then injecting a contrast in close proximity to a blockage. It is an invasive procedure, but the advantage is if you are already there and you find a blockage, you can open up the blockage with a balloon or a stent. The other 2 non-invasive tests, which are equally good in diagnosing peripheral arterial disease or PAD or CT angiography or MR angiogram, and both of them use contrast material which can affect the kidney, so we need to be prudent about using the right amount of contrast to get the best possible images. Here's an example of a CTA which is showing diffuse disease involving arteries of both legs. The arteries appear to be chewed up along with a significant amount of calcium deposition, which is showing up as bright spots. And here is an example of a MR angiogram showing critical blockage here and also a missing segment of the artery in the midsection on the right side here. So once we have established this, what kind of treatment options are available? From a mechanical point of view, if you have a critical blockage, say like 90% or 99% blockage, the mechanical obstruction needs to be relieved. The mechanical obstruction is addressed by 2 different types of procedures, namely placing a stent or by doing a bypass surgery. First, let us look at how a stent is placed. A guide wire is passed through this arterial blockage, and this wire is placed in a balloon is placed here, and the balloon is inflated first, and that is replaced with a second balloon with a stent mounted on top of that. And when that balloon is completely inflated, the wire mesh stent plasters to the arterial wall, thus preventing any plaque from getting disrupted and creating any further blockage. Stents can be placed anywhere along the arterial tree, from the groin all the way to the mid portion of the leg. But however, when you get to arterial segments which are less than 2.5 millimeters, we may not be able to place a stent in those circumstances. The second type of approach we have is called bypass surgery, where either a vein or a graft is used to connect to the proximal segment of the artery before the blockage, and this bypass graft is attached to the distal end beyond the blockage. In that way, the blood flow bypasses the arterial blockage and it improves the circulation to the leg. In fact, here is a CT angiography showing one of such examples. Here is a totally occluded native blood vessel, and here we see a beautifully highlighted bypass graft which is improving the blood circulation beyond this area of blockage. So these 2 procedures are both done in a hospital setting, and if you have a bypass surgery, you may be in the hospital for 2 to 3 days. If it's a stent procedure, you may be able to go home same day or the next day. Here a local anesthesia is used, but for leg bypass a general anesthesia is going to be used. One of the things I would like to caution you about the success rate of any one of these procedures is not as good as we would see in like a coronary artery bypass surgery or carotid endarterectomy. And that's one of the reasons we need to be very, very aggressive in trying to minimize the risk factors for peripheral arterial disease. And here's an example of a patient who had almost what looked like a gangrene of the great toe with severe discoloration of the toes, and which remarkably improved after the bypass surgery. So this is what a bypass surgery can do: salvage your leg, prevent you from getting any further gangrene, prevent you from getting serious blood infection, and improve the circulation and save your leg. Because if this is not treated, eventually it can lead to amputation. Let us talk about what you need to do as a patient if you have peripheral arterial disease. It is exceedingly important that your role is as important, or I should say more important, than a cardiologist or a surgeon's role in removing or improving the mechanical block. First of all, if you are smoking, I would strongly suggest stop smoking. Smoking can lead to worst possible complications such as gangrene, blood infection, which can eventually lead to amputation. Smoking also worsens the plaque formation rate. As a result, if you had surgery or stent placement, you're still at a very high risk for develop new blockages, which can eventually lead to poor circulation and the complications we talked about. Second, we need to have a strict control of blood sugar for decreasing the rate of progression of the arterial disease in the legs. Similarly, blood pressure control also helps to minimize the further buildup of plaque in the arterial segment. The same principles apply as far as diet is concerned by lowering cholesterol and fat intake. So by decreasing the LDL cholesterol, which is usually deposited in these plaques, we can decrease the rate of progression of these atherosclerotic blockages. And more importantly, if there is discoloration in your foot, if there is discoloration associated with some redness and some breakdown of skin, that is something that needs prompt medical attention. That may be an indication that the circulation is getting worse and it needs to be promptly diagnosed and appropriately treated. If there is a critical mechanical blockage that needs to be opened up in order to save the leg and in order to prevent gangrene or serious blood infection. I would also like to emphasize that you need to have regular medical checkups so that your doctor can detect any sign of worsening of the peripheral arterial disease and catch them at the early stages, improve the circulation, prevent any major devastating crippling complications. Peripheral arterial disease is a chronic disease, it's a lifelong disease, and it needs multi-pronged approach to minimize the complications, save your leg, and improve your quality of life. Please do subscribe to our YouTube channel. We also have a Facebook page, which is a NNN Media. We would like you to visit our page and like it. Until next time, I am Dr. NIK NIKAM for NNN Media. Have a wonderful day. Thank you so much for watching this video. Please do subscribe to our YouTube channel.